Doctors and nurses from western Montana answered the call for help when New York hospitals became overwhelmed with COVID-19 patients. Some of them actually flew there to help save lives, while others stayed right here, finding themselves on the front lines of this crisis, even though they were thousands of miles away. There's a bank of computer screens at Missoula's St. Patrick Hospital where doctors use telemedicine to offer their expertise to doctors around the country virtually. And as New York became overwhelmed with COVID-19 patients, doctors here knew they could help.
I think they were doing a fantastic job with the resources they have, but taking care of complicated ICU patients with multiple organ systems that are failing is nuanced care and requires a lot of specialty training. So they were avid for whatever advice and guidance we could give them.
As an anesthesiologist and critical care physician, Dr. William Serber and others guided New York doctors in the battle of COVID-19, as some of those doctors didn't have that specific expertise.
I remember rounding with somebody who was an orthopedic surgeon who had stepped up and is actually managing an ICU patient. And these are complicated patients. These are difficult to manage in all the best scenarios.
Through the wonders of technology, doctors here could look over the exhausted shoulders of doctors there, offering their expertise, a second set of eyes, and even reassurance they were doing what's best for their sick patients.
With a cameras and microphones and computers, I was on their electronic medical record so that I could see all the data on each patient. We would go around to every single patient and discuss all the aspects of their care.
Dr. Serber and the other physicians were able to treat these COVID patients without being exposed to the virus themselves. But what they were exposed to was the kind of experience that will come in handy if COVID-19 flares up here.
This gave me and the other Missoula physicians who were doing this infinitely more experience at managing these patients firsthand. So I think that if we do end up seeing a higher volume of COVID-19 patients in Missoula, it makes us better positioned to take really good care of them here.
And now, with a more manageable patient load in New York for now, Dr. Serber and others are able to take a break from those virtual overnight shifts in New York, but they're ready to help with guidance and advice wherever they're needed.